Welcome to AI on the Block, featuring Max Ledger and Allison Hashwell, presented by Evolve Blockchain.
Hey everyone, and welcome back. Today we're diving into something pretty cool. You guys specifically requested this one. Decentralized health data management using NFTs.
NFTs, huh?
Yeah, NFTs. I know you're thinking.
Yeah.
NFTs, those digital collectibles.
Right?
But get this. They can actually be used to give you way more control over your medical records.
It's a fascinating concept, right? This technical document that we're looking at today lays out a system that could potentially revolutionize how we think about health data ownership.
Okay, so walk me through this.
Sure.
The document talks about a decentralized health data account. What exactly does that mean for someone like me?
Imagine this. Instead of hospitals or insurance companies holding your data, it's stored securely on a blockchain in an account that you control.
Okay.
Think of it as your own personal health data vault.
So instead of paper records scattered across different clinics,
Yeah.
it's all in one secure digital space that I own.
Exactly. And here's where NFTs come in.
Okay.
They act as the keys to this vault. You decide who gets a copy of the key. Maybe your primary care physician gets one, and a specialist gets a different one, with access to specific parts of your records.
So I can give my allergist access to my allergy history.
Yep.
But they wouldn't be able to see, say, my dermatology records.
Precisely. You have granular control over what information each healthcare provider can see.
That's pretty amazing.
Yeah.
But what's to stop someone from, I don't know, like making a copy of the key and accessing information they shouldn't have?
That's where smart contracts come in.
Okay.
They're like digital rule enforcers built into the system.
Gotcha.
Let's say you give your doctor access to your records for a week. After that week, the smart contract automatically revokes their access.
Interesting.
No need to call the clinic or worry about who still has your information.
Wow. So no more chasing down records or filling out endless forms for data transfers?
Exactly.
That's great.
The system makes it much easier to share your records securely and efficiently, even with doctors in different countries. Imagine you're traveling and need to see a doctor. You could grant them temporary access to relevant parts of your medical history with just a few clicks.
That would be incredibly helpful. No more carrying around bulky files or trying to explain my medical history in a foreign language.
And think about the benefits for people who move frequently or see specialists in different locations.
Yeah.
This system could streamline the entire process.
That's a great point. It sounds like this system could be a game changer for people with complex medical histories who need to see multiple specialists.
Absolutely. It could also be a huge benefit for medical research.
Oh, interesting.
Imagine a world where researchers could access anonymized health data with patients' consent,
Okay.
leading to faster breakthroughs and more personalized treatments.
So instead of relying on limited data sets,
Right.
researchers could potentially access a vast pool of information, all while respecting patients' privacy.
Exactly.
Wow.
It's about leveraging the power of data while maintaining individual control and privacy.
That's pretty remarkable.
Yeah.
Okay, so we've talked about controlling access and sharing records,
Yeah.
but what about everyday use?
Sure.
Can I actually see and interact with my own health data in this system?
Absolutely. The document describes an application that works alongside the decentralized health data account.
Okay.
You can log in and see your records displayed in a clear, user-friendly way. Think interactive timelines, easy to understand summaries, and visualizations of your health data.
That sounds way better than trying to decipher those confusing paper files we sometimes get from hospitals.
Right. And it's not just about viewing data.
Oh.
You can also request access to someone else's data with their permission.
So, for example, if I was caring for an aging parent, I could easily access their medical records with their consent to help manage their care.
Exactly. It could also be valuable for researchers collaborating on projects or families managing the care of loved ones.
Interesting.
It promotes transparency and collaboration while still prioritizing individual control.
This is all starting to sound like something out of a sci-fi movie. But it's real, right?
It is. This technology is being actively developed and refined.
Wow.
There are pilot programs and initiatives exploring its potential in various healthcare settings.
Okay, now I have to ask about this emergency access feature.
Oh.
It sounds like something straight out of a medical drama.
It is pretty clever. Imagine you're in an accident and can't communicate.
Okay.
This system allows you to designate someone, maybe a family member or a close friend, as a secondary account.
Got it.
They can grant emergency medical personnel temporary access to your entire medical history, even if you're unconscious.
So even if I'm unable to give consent, doctors can still get the information they need to provide the best possible care.
Exactly.
That's reassuring.
It ensures that critical medical information is available when it's needed most, potentially saving lives.
That peace of mind alone would be worth it. But it sounds like this system goes beyond just storing and sharing data. It gives patients a level of control and agency that we've never had before.
It's a fundamental shift in how we think about health data ownership.
Absolutely.
It's about empowering individuals to be active participants in their own healthcare journey.
It feels like a real paradigm shift in how we think about health data ownership and access. But are there any potential downsides or challenges to consider? No system is perfect, right?
You're absolutely right. One of the biggest challenges is ensuring widespread adoption.
Okay.
For this system to truly work, both patients and healthcare providers need to embrace it.
So it's not just about building the technology, it's about getting people to trust it and use it.
Exactly. And that takes time, education, and addressing any concerns people might have about data security, privacy, and the potential for misuse.
Yeah, I can imagine there might be some skepticism, especially given the sensitive nature of health data.
Sure.
People want to know that their information is truly safe and secure.
Absolutely. Building trust is crucial.
Yeah.
And that's why transparency about how the system works, the security measures in place, and the role of blockchain technology is so important.
And what about accessibility? Could there be challenges in making sure everyone can use this system regardless of their technical skills or access to technology?
That's a crucial point.
Yeah, it's something I think about a lot with new technology.
We need to ensure that this technology doesn't exacerbate existing health disparities or create new barriers to care.
Okay.
Designing the system with accessibility in mind, providing user-friendly interfaces, and offering support for those who need it will be essential.
It sounds like there are a lot of moving parts
Yeah,
and potential challenges to address.
definitely.
But the potential benefits are so compelling. I
Yeah,
can't help but feel optimistic.
I agree.
Yeah.
This technology has the potential to revolutionize healthcare, but it's going to require collaboration, careful planning, and a commitment to addressing these challenges head on.
Okay, so let's shift gears a bit and talk about the bigger picture.
Okay.
If this system were to become widely adopted, how do you think it might change the way we think about healthcare data ownership and access in the future?
That's a fascinating question. For so long, we've passively handed over our health data to institutions,
It's true.
trusting them to keep it safe and use it responsibly.
Yeah, we kind of just have to trust them.
This system challenges that paradigm, putting individuals back in control.
It's almost like a philosophical shift from seeing health data as something that's collected and stored by others to something that we own and manage ourselves.
Exactly. And that shift in thinking could have far-reaching implications.
So,
It could lead to a more patient-centered approach to healthcare,
yeah,
where individuals are actively involved in decisions about their own care.
I like that.
It could also foster greater trust and transparency between patients and healthcare providers.
It's really fascinating to think about the possibilities, both in terms of practical improvements to healthcare and these larger, more philosophical shifts in how we view our own data.
Absolutely. And it's important to remember that this is just one example of how blockchain technology is being explored in the healthcare space.
Right, there's so many other potential use cases.
There are many other exciting developments underway,
Yeah.
all aimed at leveraging the power of decentralization to empower patients and improve health outcomes.
It sounds like we're on the cusp of a major transformation in healthcare.
We might be.
And it's all thanks to this innovative approach to data management.
That's a great way to put it. And it'll be fascinating to see how this technology evolves and what impact it has on the healthcare landscape in the years to come.
You mentioned there are even more features that focus on accountability and transparency. That's a big deal in healthcare. So I'm really curious to hear more.
You're right.
Yeah.
Transparency can be a game changer.
Yeah.
And this system tackles it head on with a built-in rating system for healthcare providers.
Wait, so I could actually rate my doctor like I would a restaurant or a ride-sharing service?
Exactly. After an appointment,
Wow.
you could rate your experience based on things like communication, wait times, bedside manner,
Okay.
and overall satisfaction.
And these ratings would be visible to other patients.
Yes, they would be stored on the blockchain,
Okay.
accessible to anyone looking for a new healthcare provider.
So it's public.
It could help people make more informed decisions about their care.
That's a bold move.
Yeah.
I can see how it could promote accountability.
Uh-huh.
But wouldn't doctors be hesitant to join a system where they're constantly being rated?
It's definitely a shift in the power dynamic.
Yeah.
But think about it this way. Patients already share their experiences through word of mouth and online reviews.
That's true.
This system simply provides a more structured and transparent platform for that feedback.
That's a good point.
Yeah.
It could incentivize healthcare providers to prioritize patient satisfaction
Right.
and really focus on improving the quality of care they deliver.
Exactly. And it could also help patients find doctors who are a good fit for their needs and preferences.
Right.
Imagine being able to filter doctors by their communication style or their approach to treatment.
Okay, that makes a lot of sense.
Mm-hmm.
So we've covered a lot of ground here, from controlling access to our data and sharing it securely to rating healthcare providers.
Yeah.
And potentially even contributing to medical research.
Yeah, it's pretty...
It's a pretty mind-blowing concept.
It is.
It really is.
But I think the most important thing to remember is that this system puts individuals in the driver's seat when it comes to their health data.
Right.
It's about empowering patients to make informed decisions. For now, let's circle back to this specific system.
Okay.
We haven't touched on one final feature that's pretty straightforward but incredibly useful.
So what is it? What's this final feature?
It's the ability to download your entire medical record as a PDF file.
So even though my data is stored securely on this blockchain, I can get like a traditional copy if I need it.
Exactly. That way you can easily share your information with healthcare providers who might not be using the system yet. Or for any other personal needs.
That makes a lot of sense. It kind of bridges the gap between this new technology and the existing healthcare system.
Right. It gives patients that flexibility and ensures they're not locked into one specific platform.
Well, this entire deep dive has been incredibly eye-opening. We started with NFTs as digital art, and now we're talking about them as keys to our own personal health data vaults.
It's amazing.
It is amazing to see how this technology is being used in such innovative ways.
It really highlights the potential of blockchain to transform industries far beyond cryptocurrency.
For sure.
This decentralized system offers a glimpse into a future where individuals have more control, transparency, and security when it comes to their health information.
So to wrap things up, let's recap the key benefits of this system.
Okay.
First and foremost, you have complete control over your data.
Right.
You decide who accesses it and for what purpose.
Second, the use of blockchain technology ensures top-notch security.
Absolutely.
Your data is encrypted and virtually tamper-proof, making it far more secure than traditional systems.
And third, it really simplifies sharing medical records. No more faxing or tracking down paper trails.
Yeah, no more of that.
You can grant access to doctors with a few clicks.
Exactly.
No matter where they are in the world.
It's all about streamlining healthcare and putting patients in control. And that brings us to our final thought-provoking question for you, our listener.
Oh, yes.
Imagine the system becomes the standard for managing health data. How might that change the relationship between patients and healthcare providers? Would it lead to a more collaborative and trusting environment?
What new possibilities or challenges might arise as individuals gain more ownership and agency over their health information? It's a future worth pondering as we explore these groundbreaking technologies and their potential to reshape healthcare as we know it.
Thanks for joining us on this deep dive. We hope you learned something new and exciting about the power of NFTs and blockchain technology to transform healthcare. Until next time, keep exploring and stay curious.
Thanks for listening. Be sure to join Max and Allison next episode as they dig deeper into the different facets of Evolve blockchain. This has been AI on the Block.